One of the things that I really focus on and makes me happy to provide for people is whenever I'm recommending things, whether it's supplements or testing, I like to take the pressure off of them that I'm not pressuring you to do any of this. I am simply supporting you from my knowledge base and my care for, your pet and you is what I think is going to give your pet the most value to get healthier. Client education is of utmost importance to me because that way you can be the best advocate for your pet. Because once a pet parent is empowered with knowledge and support, then they can be the best advocate for their pet.
We actually did the math comparing going to a conventional veterinarian for the same amount of time that we had spent with the integrative vet. And honestly, it comes out to be around the same price.
It's so much better to pay for better health than it is to pay for sickness.
Thank you for tuning in to the Next Level Pet Parent Podcast. Now, let me tell you, this episode is pure gold for every single pet parent, and I think this may be one of the absolute best episodes yet. We had so much fun recording it, and I know you will enjoy every single minute of it. In this episode, we're exploring the differences between holistic, integrative, and conventional veterinary care so you can explore what type of veterinary care is best for you and your pet. Veterinarian Dr. Katie Kangas joins us with expert tips on finding a vet who truly understands your pet's unique needs and shares practical steps to help you find the perfect fit. I am absolutely passionate about this topic because I know exactly how it feels to feel absolutely helpless and frustrated at the veterinary office, questioning every piece of advice and even being made to feel like I'm doing the wrong thing for my dog. But I also know what it feels like to have found a veterinarian that I deeply trust and with whom I feel empowered and confident with. So today, I'm very excited to help you on your journey on finding a vet that aligns with your values, whom you can also feel very comfortable with. So stick with us to learn how the right vet can lead to fewer vet bills, better health, and a happier pet and pet parent. One more thing before we dive in, I'd like to emphasize that our discussion today isn't about defining a right or a wrong way to practice veterinary care. Instead, we're here to help inform you as a pet parent about the variety of different veterinary approaches available, exploring how each one differs from the other one. Our goal is to equip you with the knowledge so you can choose the best veterinarian for your pet based on what feels right for you and meets your unique needs. Let's jump right into this episode.
Welcome, Dr. Katie Kangas. Thank you so much for joining us today on the Next Level Pet Parent Podcast.
Thank you so much for having me. It's my pleasure to be here. Thank you, Charlie and Larry, for all that you're putting out there and all that you're sharing with pet parents. It's my pleasure to be a part of that.
We are so excited to get your insights today on the topic of veterinary care and the difference between the different types of veterinary care. To start off, can you tell our listeners a little bit more about yourself and what you do and how you started this path of becoming an integrative veterinarian?
Thank you. I absolutely will love to do that. And I'll just start by saying I really like this topic. Thank you for bringing this to everyone. There are so many different resources becoming more and more available in not only veterinary medicine, but human medicine. And it's really nice for people to learn more of a scope of what's out there and how they can utilize that to, the best strengths for their pets or themselves even. I mean, some people may get some ideas of things they can do for their own health today too, or how to choose doctors and things. So this is such a great topic. How I got into it, my story is I've actually been a veterinarian now for a little over 30 years. Can't believe I can say that, but I graduated in 1993. And I started mainstream veterinary as we all do. And I worked in private practice doing general surgery or general medicine and surgery, et cetera. And then I got into, well, I actually tracked through vet school, but I did wildlife and zoo medicine for a bit and worked with wildlife, and then tracked into, fell into shelter medicine. So I've been a shelter vet for years, and I actually was the director of medical services at the San Diego Humane and SPCA Humane Society here, and I worked at the county shelter as well. So I did shelter medicine for 15 years.
Mm.
But
Wow.
then during that time, and that was kind of pre and post, but during that shelter medicine time is when I really got more interested in holistic medicine. And what really drove me to reach out into that space is, of course, my own pet. And typically our pets tend to be some of our greatest teachers in life, and teachers and supporters. And my dog at the time, which I have her picture actually right here, so I'll just show it for fun. But this is
Aw,
Asti.
Oh,
Her name was Asti, Asti,
so
and
mm,
she
cute.
was a lab mix, as you can see. And this was back in like 2005.
mm,
And she was having older age. She was like 12, 13 at the time. And she was having older age issues with um, getting hind end weakness and lumbosacral, like back in the lower spine, lower back,
mm. Okay.
inflammation and issues back there. And she was falling down and kind of knuckling and having trouble, defecating, pooping. And there
Mm,
just wasn't a lot of options that Western medicine had to offer her to an improved quality of life. And so that's when it really pushed me to seek out. And I'd always been interested in holistic, but I didn't really know anybody who did it. And so this kind of pushed me to find that resource. And I went and got, her started with acupuncture. I changed her diet. I was feeding kibble then. I didn't
mhm,
didn't know all the things I know now, and changed her diet over to, fresh food, started acupuncture, started chiropractic, started some herbs and nutritional supplements. And Asti literally turned around so much that she went from falling down to lightly jogging again. I mean, she was walking
wow.
great. I know we did. And she literally got another 2 years of high quality life
That's amazing.
before she really just, her musculoskeletal system was just kind of done at that point. But it was so inspiring, the amount of quality time that we got together through that
Mhm,
process. I'm like, I have to serve other people in this way and serve other pets in this way. And so I resigned from the shelter and went and enrolled in the Chi Institute, which is the Chinese medicine acupuncture course down in Florida. And
okay.
that was my gateway
Yeah.
into holistic medicine. And a lot of us do, a lot of holistic vets or integrative vets, we start in acupuncture and Chinese medicine and then often branch out from there. And that is what
Mhm,
I did. And I then took food therapy, courses and herbal courses and Chinese herbs and Western herbs. And
mhm,
then bringing you up to speed with current status for me. Part of what I do now, actually a large focus of what I do now that I evolved into as well, is what we call functional medicine. And
okay.
functional medicine is a new buzz term in the, human health sector too, especially with naturopaths and et cetera, but functional medicine doctors, where, we're really integrative. We're looking from a medical aspect, but also a holistic aspect at the same time, in really helping to identify root causes of issues, but also supporting the body's optimal functioning, and optimal health and balance through either nutrition or hopefully removing toxins, removing processed foods. So, removing things that are causing damage to health, and deterioration and inflammation, and supporting the body with the best tools you know, to build it up to function at its best, at its, innate opportunity of best with either nutrition or nutritional supplements, et cetera. So now I
Mhm.
really kind of come at the approach with functional medicine, but that's within the realm of integrative and holistic as well.
Wow, like, that sounds like a really inspiring story, as you said, like, 'cause what happens often is there's a pet that leads us down a pathway to explore more alternatives, and then from there, you've been able to help so many animals in your career.
Right. It's such a beautiful, story and, origin for so many of us that get driven to do what we do. And, it's so rewarding and it's such a strong passion, but probably same for you guys. Are you doing this because, you're
Yeah. You know what?
Exactly.
And actually, this is such a great topic, honestly, because I always think about myself when we first got Milka and we went um to a pet store and we were looking through all of different types of food. We just didn't know where to start. Then Milka ended up getting sick. We ended up actually going to a conventional veterinarian who kept advising us to feed, kibble and whatnot. And what actually led us down the pathway to learning more about holistic veterinarians was that we ended up changing her diet to a raw food diet, based on the recommendation of a friend. And we were just blown away on the fact that conventional veterinarians were advising us not to feed the very thing that made our dog insanely better. Like, it made her so much healthier. And we were like, you know what? We have to research this. We need to figure out, why aren't people talking about this?
And also, like, essentially what it evolved into is giving a lot of integrative and holistic veterinarians a platform as well. Like, we're so grateful to be able to kind of amplify your voices as well, because you are out there doing all the work, doing all the research, and working with all the pets, helping the pets, and like, we're just so happy that we're able to, like, take your voices and share it with pet parents. And also, like, one thing actually that surprised us was that at Podega, our customers, they ask us all the time, like, which vet can I go to? Do you recommend any specific vet? And we have this conversation with them, and then we realize that a lot of pet parents actually don't really know that there's such a thing as a holistic veterinarian or an integrative veterinarian or a functional veterinarian. So there's this misconception that there's only one type of vet. And a lot of pet parents, they also aren't very familiar with the idea of, like, getting a second opinion from a holistic vet. Or, I mean, I think we're going to get into, like, what to do if you don't have access to a holistic vet. We're going to get into that topic a little later. But to start off, can you just explain what exactly are the differences between the different types of veterinarians and what each vet care entails?
Absolutely. And I love actually the term that Larry used, conventional medicine. I like to use that term too. So the categories I think that we'll talk about, the three categories, is conventional medicine. Then we have holistic, but also integrative. And those are obviously, aligned and similar, but there might be a little bit of a different sort of nuance with those. But I do like the term conventional that Larry used as well, because a lot of people use traditional and they're like, traditional, medicine or traditional veterinary medicine. I'm like, well, that's not really the best word, because truly traditional, like
Yes,
old historic, like traditional, is actually natural.
exactly.
Modern Western medicine is not really traditional unless your traditions don't go back very far.
Yeah,
So,
so true.
so that's like a fun little, discrepancy to put out there too, is, but a lot of people do, if you hear people say traditional, they're often talking conventional. So let's define conventional, which of course is modern day Western medicine. And it has many, many attributes. Obviously there is a time and a place where all of us and our pets will likely need some, conventional medicine
Yeah.
support. And certainly the time where we clearly know that conventional medicine shines is anytime the body's in major crisis, and that often can include trauma or injury. I mean, obviously, if a pet gets hit by a car, or you know whatever, falls off a balcony, I mean, all kinds of stuff, trauma can happen. And that's where you really want your urgent care, your conventional care. Or even in a disease crisis, like there's a lot of times where there might be chronic health patterns that are, just brewing and brewing and kind of progressing along, and all of a sudden the body tips into a crisis time, but it's still a chronic disease, but now you're in a crisis. And that could be, now I'm diabetic and I'm in diabetic ketoacidosis, or that could be I've had a heart murmur for a while, and all of a sudden you tip into congestive heart failure. So those are circumstances too where, and we'll get into the holistic. You can always use holistic for all of these things, but there is a time when the body gets into sort of a crisis or, significantly out of balance state, or injured. Then that's where we want to turn to our conventional medicine for sure. And
Mm.
then, holistic, I guess I'll go to that and then finish with integrative. Holistic, really, the term holistic means whole body health. And that actually includes, like, it's like whole person health or whole pet health, because even expanding from the body, we're also in holistic approaches, we're including the mind, body, mind, spirit. So the mind, the mental status, the spirit, the constitution, all of that is included in the context of holistic healthcare approach, which is such a beautiful thing because everything is connected. And that's
Mhm.
really the basis of holistic, is everything is connected. And then also holistic is always, using natural therapies is essentially. So, natural therapies can include nutrition and diet, obviously, nutritional supplements, herbal supplements, and that could be Chinese herbs, Western herbs, and homeopathy, etc. So all of those things would be holistic tools. And then with the integrative category, which is so amazingly, awesome, because integrative means that we're combining any appropriate tools from all of those categories. So integrative, certainly, just like holistic, very much approaching the root of the root of the problem, really trying to elucidate the cause so that we can truly assist that body to heal and to come back into balance. And so that's the whole point of integrative. However, integrative may be a little more expanded beyond, typical holistic, although sometimes they're just used synonymously. So some people may say it's a holistic vet and it's really an integrative vet. So those terms are used pretty loosely. But if you really sort of look at kind of the definition, that's where I think the margin would lie, is that integrative will more often use some conventional medicine strategies. By the way, integrative veterinarians, we love testing. Same thing with, naturopath and integrative
Mhm.
human practitioners, is that within reason, the more testing we can do, like blood testing, nutrient level testing, we want to check for deficiencies. I love to see, is there vitamin D deficiency? Is there a B12 deficiency, an omega-3 deficiency? Um, a human naturopath, one of the first things, if a person goes into integrative, they want to test you for deficiencies and they want to test you for toxins and see what your body's hanging on to that is causing damage and, health demise. And so same thing, from a veterinary angle, is the more testing we can do, the more customized we can be to support that particular individual to a better health status. And
Mhm.
so, integrative, but we may use, and obviously some of that's conventional medicine. We're doing blood testing, we're doing all this, but we get outside the box of what a lot of conventional veterinarians are going to do. And the fact that they're not testing vitamin D levels and nutrient deficiencies, they're not testing microbiome, testing. We love to do that. Food
Mhm.
sensitivity testing, for allergies, that kind of thing. So integrative, practitioners are really going to branch out into, as much testing as is reasonable for that pet, that fits into the pet parent's budget. And we'll get into that. I love to prioritize for people, but that's really the integrative strength, is using the best of both worlds. And I support people, because I am integrative. I support people to use conventional medicine when it makes sense for their pet.
Mhm.
Obviously, conventional medicine does have the downsides of medications tend to be overused. They tend to be used long term, even when that's not in the best interest of the pet. Um, Conventional medicine tends to, um, you know, be treating with medications, tends to be symptomatic treating, treating the symptoms rather than really getting to the root cause. And so, what I find from an integrative approach is that when my patients come to me, that part of my work and my goal, part of my work for people, is to really help decipher what are the medications that a pet is on that make good sense for them to either remain on or be on for the moment, and what things can we remove. And my approach is always to try to reduce or remove medications, and we almost always are successful in that, because in my opinion, most of the medications can be used temporarily just to get the body out of that crisis zone. And
Mhm.
then we move in all the great holistic tools. Maybe we've done some testing already to see what
Mhm.
the pet person really needs. And then we move in the holistic tools to be able to get the body back into better balance and let go of some or all of those medications. So yeah, so that's the beauty of integrative.
Thank you so, so much for explaining it so well. I think honestly, I'm so grateful that we have integrative veterinarians like that we can go to and take our pets to, because I cannot state how amazing it feels. I can't put it into words how amazing it feels to have a veterinarian that you trust, first of all, but then also who has the knowledge of both worlds and
Mhm.
who's truly able to tell you, like, okay, right now, this is the situation, lay it all out for me as a pet parent, and then tell me where I can go the holistic route, and go the natural route as far as we can take it. And then when it's not possible to go any further naturally, then we can talk about medication and the more conventional side of things. Like, honestly, it's beyond words. Like, I'm so grateful to have that available to me, because we've been in situations before where we really, really wanted to go the natural route, but like, obviously, if it's not good for our dog, and if that would, like, if the natural route would mean she's in more pain than she needs to be, or it's just not possible, then obviously we would go the conventional route. Being at an integrative vet it's really like priceless to me. Like,
And
I would just, like, it's really priceless
Yeah.
thank you
to
for
me.
sharing that,
Yeah.
Charlie, because that's truly, I mean, that just fills my heart to hear you say that, because that is what, my whole mission is about, and what
Yeah.
my
Mhm.
passion is about. And I love to hear you say that, because I love when people come to me for a second opinion. I'm very eager to share, the other side, but even more than the other side, like, how do we integrate the conventional part, and support the pet to the fullest. And I
Mhm.
Mhm.
oftentimes, some of my new clients that haven't met me before are surprised when I say, hey, let's have if you can, I'm going to recommend that your pet see a cardiologist, or
Mhm.
Mhm.
a neurologist, or whatever. Like,
Mhm.
we need some conventional diagnostics and assessment, so that we can figure out exactly what's going on, and then we can be of stronger impact with our holistic tools or our integrative
Exactly.
tools once and we don't have to go one route or the other route. We can go both routes. We can,
Mhm.
many of my patients
Mhm.
are on, conventional strategies of things, and then we move in the holistic strategies as well. And then you get a better outcome. And I love to tell people that is, no matter what, I can confidently tell you, when you're implementing holistic strategies that match that pet that, the pet
Mhm.
is doing well with, you will always get a better outcome than if you're not including those things, you know?
Exactly.
Yeah.
Yeah.
And so, that always just makes everything even improved. But then we get to work on what are the conventional, pieces that align with this pet for now. And, from an integrative approach, I find that the majority of the time, there's a lot of things that we can remove from the conventional medicine,
Mhm.
once we move these other things in. But some things we need to keep doing, and everybody's
Mhm.
individual. And the other definition I love of integrative medicine that I've heard recently is N of one. And N
Mm.
means like your sample data, like when,
Okay.
in
Yeah.
scientific research, it's like your N is your like sample. And so that phrase is just saying, sample of one, you are the only you, and
Mhm.
your pet is the only that pet person, and
Yeah.
everybody is individual, everybody is different. So we want our health support approach to be as customized as possible, literally to the N of one,
Mhm.
That's
Absolutely.
Mhm. And I just want to add, like, because one more thing that I really like about what integrative veterinarians do is that they look at what what drugs an animal might be on, and they say, or they'll look at the side effects and take them very seriously. And they say, well, if you're going to give this drug to an animal, well, let's try to see what we can do to offset, whatever possible damage is being caused to any of the organs of the body. So if it's going to hurt the liver, well, let's start using liver supporting supplements or foods for that animal, just as an example.
I love that. I'm so glad
Hmm.
you brought that up, Larry, because that's true. That's one of the other strengths of our natural holistic tools
Hmm.
is to support the body even better when we have to be using other things.
Hmm.
Like you said, liver support and many other options to reduce the side effects and, any of the negative effects that those can cause for the body, just to bring the body into, even better balance while they have to use those tools. So,
Hmm.
yeah, great point. Good
Yeah.
strengths there.
Something else that you brought up earlier was that you and other integrative veterinarians love to do testing. And as much as is reasonable, you mentioned, for that particular dog. And that's actually something that a lot of pet parents I hear that go to conventional veterinarians, they often say, oh, they just want to do a bunch of tests and then they're just going to give me XYZ.
Hmm.
But actually looking at it from a different perspective, like testing isn't a negative thing. It's a good thing to figure out what's actually going on so that medications aren't just given like a blanket, like,
Hmm.
for everyone, and we don't really know which bacteria we're trying to kill, or what
Right.
we're actually trying to do. So like testing as a whole is actually, or testing in general is actually a good thing. And then especially when you are at an integrative vet who can then tell you exactly like how far to go naturally as well. So
Absolutely. And thank you for bringing that up, Charlie, because it is a struggle, and a confusion spot for a lot of pet parents is that in sort of today's modern medicine world, testing is, like you said, really, um, recommended in such broad strokes. There's so much that is available, and that's partly because technology is so advanced. I mean, decades ago you'd go to your vet or your doctor and there would be very few tests recommended because there really wasn't all that available, and so people are like, gosh, are they just throwing all this at me to try to make money or whatever? And sometimes there's a fine line. I mean,
Hmm.
sometimes some veterinarians and some veterinarian, I would, I'll just make this distinction because it really is, it really is true, and should at least be recognized by people that corporate, unfortunately, veterinary medicine is starting to go corporate because everything is so expensive. Medical care is expensive. I mean, to run a
Hmm.
big veterinary hospital that offers full service with surgery and ultrasounds and x-rays and staffing, and you have to staff all these people, and that's really expensive. And the old family veterinarian that knew everybody really well, knew their clients, knew the pets, and was more individually approached with, really helping people to figure out with their budget, what could be done. But there wasn't all of that, the bells and whistles going on. And now you've got all this stuff available. And so it's very difficult for a lot of private veterinary small business owners to manage that kind of a cost scenario. And so a lot of veterinary practices are going corporate, the VCAs and the Banfields and all this kind of stuff. And unfortunately, that's where it gets to the point where, there's sort of an algorithm where the patient comes in and, the corporate medicine structure in that hospital says, if they have these symptoms or this presentation, you do this, and this, and it literally spits out all these tests. So then they just,
Wow.
spit out a little printout, and your pet needs an ultrasound and an x-ray and blah, 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 blah. And people are like, I just walked in the
Mm.
door and I'm getting an estimate for, $3,000.
Mm.
And so it is really overwhelming. And from an integrative standpoint, I can say some of those tests are warranted, but some of them may not be so reasonable or may not be out of the gate. Like, you don't need to necessarily hit that from step one. And so one of the things that I really, um, focus on and makes me happy to provide for people is whenever I'm recommending things, whether it's supplements or testing, I always tell people, because I like to take the pressure off of them, that I'm not pressuring you to do any of this. I am simply supporting you with, from my knowledge base and my care for, your pet and you, is what I think is going to give your pet the most value to get healthier. And it's up to you to figure out what your budget can do, because everybody's budget is different, but budget is, for the vast majority of people, is a factor. Let's face it. And so part of my value to people is that I always tell them, I'm going to put everything in a priority order for you. When I
Mm,
list out supplements, I may list out 3 to 5 supplements in any one visit. I tell people I'm not going to, there's dozens and dozens of supplements that I
yeah.
could name that are all awesome, that would all add value to your pet, but we can't go, gonzo like that, and we don't want to overwhelm the pet or the person. So I always tell people I may list in any one visit 3 to 5 supplements to slowly, add in, never all, things at one time going in. And I, it's my system to make sure that I put the highest priority first.
Yeah.
What do I think is the most important lead-in product for your pet? And then we'll slowly build from there. And if it takes you 2 to 4 weeks to build, that's a nice time frame, or longer, that's okay too. And the same thing with testing. When I'm recommending any diagnostics or other things, I also put that in order for people. Hey, we need to start with some baseline stuff, or, it really looks like your pet might have a thyroid problem. Let's put a thyroid test at the top of the list. But I would love to do a microbiome test, but that may not be the highest priority right now. Let's put that at the bottom of the list. And so that way people, the pressure's off. They see these are really good things, but I can go through this stepwise to what I feel good about with my intuition, but also with my affordability.
And honestly, this type of approach is so very much appreciated. We have been in this situation before where we were at the office of an integrative veterinarian, and we got a priority list as well, even with the tests that we should do. So there was like lots and lots of tests that are important to do diagnostics, but she also put it in a list of priority, which we absolutely appreciated. So,
I
and
am
also,
so happy to hear that other people are doing that too, because I think typically in conventional medicine, you just get one big fat estimate with like
yeah.
lots of stuff on it. And, people are overwhelmed, and it's really, really, you know, um, uh, nerve-wracking for people. So yeah.
Absolutely.
And to add to that, and speaking from experience, like because we've gone to all type of veterinarians in the beginning of our stage, we went to a conventional vet for Milka having an issue, like a digestive issue or whatever. And the the quotation comes along for us with the guilt tripping. Like, so we're like, oh, we're not sure if we want to spend this much money, if we have to make a decision right now within the 15-minute consultation. Like it's a lot of decision making. Sometimes like trying to understand what they're talking about. A lot as a pet parent, we don't even understand the terminology being used a lot of the time. And that's where like we have so much appreciation for integrative and holistic veterinarians, because a lot of the times the consultation goes way beyond 15 minutes. For us, it was over an hour. And they
Almost 2
explain.
hours, actually.
Yeah, it was almost
Yeah.
2 hours. But they explain, this is what this is. They give you a piece of paper, take notes, like it just felt so great, because it just felt like, finally somebody's listening and somebody's talking to us about the problem that, or not even necessarily a problem, but like whatever might be happening, just trying to
Yep.
get a full understanding of
Thank
what is
you.
going on, that just in conventional care, I have never personally experienced.
Almost ever. And Larry, my heart is so happy that you just explained that so well, and you put that
Hmm.
out there from personal experience. And that
Hmm.
is such a huge thing for me with anybody choosing a medical practitioner for themselves. And definitely, I think you're more likely to get the scenario you just described from an
Mhm.
integrative standpoint. There are far fewer conventional doctors that work in that way, but you can still find some, but it's difficult
Mhm.
because they're so programmed for those quick 15-minute appointments. That's how
Mhm.
things are structured to see more patients, because a lot of times there is just a high demand too. And
Mhm.
patients are waiting, but also, for probably income, making the money is, seeing the patients. With integrative, again, I think the communication piece of, connecting with the pet parent or the human patient is key. And that's something that I'm very, very passionate about doing for people. And I love how you said that when you're in the exam room and you don't even understand half the terminology and you're on the spot having to make a quick decision, is
Mhm.
that one of the things that I would suggest for people to consider is to, unless it's an emergency and the pet, needs like emergency critical care and there was just trauma or something like that, that's another story. But if any of this is not so urgent that you can take a minute to make a decision, is to get that information from that veterinarian and say, thank you for all this information. I would like to, have some time to look into this, think about it, or do a little research, or, think about my budget. I got to, figure out my finances or whatever, or any, reason you need to give to sort of take a beat and just be able to not feel like you're being pressured into something. And then you can either, do your own research or check in with a second opinion. And I think Larry
Mhm.
said that
Mm.
too, which is great. And an integrative veterinarian is, like you said, because we know both sides and we're trained on both sides, is a great resource to tap into to help you make those decisions on the conventional side too. And fortunately, I do telemedicine. We can, talk more about that too. And other integrative veterinarians do. And that may be, or somebody in person that you have availability, or access to. That is another option. But definitely a telemedicine second opinion is always a great strategy to help support people with decision making.
Absolutely. And Larry and I have been in this situation where we've lived in Dubai, a country or a city. Well, we've lived in the UAE where there was absolutely no holistic vets and no integrative vets either. So we were in a position where we actually had to go to a conventional vet, which luckily for us, we did a lot of research and we went to a lot of different conventional vets because we wanted to find one that we really liked and that also aligns with us and our values.
Perfect.
And we found an amazing conventional veterinarian who, I mean, we were so happy with her
Mhm.
because she really worked with us. It was a very respectful conversation always. She also knew what we were into, that we are in the pet health space as well. And it was a really amazing relationship. I really have to say that. But still, we did the diagnostics with her, and then we go to an integrative vet and do online telemedicine or online consultations with them. We send the diagnostics to
Yep.
the integrative vet to get a second opinion before we do anything conventional. So that is for anyone listening right now who might not have access to a holistic vet or an integrative vet. That is a really great option for you as well, to just get your diagnostics done with your regular vet and then do like any tests. You do that with your regular vet and then send the paperwork to your integrative or holistic veterinarian and do an online consultation. That's completely amazing.
Yes, thank you for laying that out so perfectly, Charlie. That's exactly what I do with my telemedicine, is get in, all the records that I can, all the past medical history and any current testing, and, go through that with people, and that communication piece of explaining everything so that people really understand what's going on. Because one of the ways to be the best parent is to be the best educated. I mean, the more
Mhm.
we know, the better we can do. And client education is of utmost importance to me, because that way you can be the best advocate for your pet, and putting the power. I love, I mean, it's actually in my tagline, empowering pet parents,
Mhm.
optimizing pet wellness, empowering pet parents, because once a pet parent is empowered with knowledge and support, then they can be the best advocate for their pet. So I love that. And the communication piece is key to support people in doing that.
All right, before we continue, I want to tell you about a brand that's truly leveled up our dog's health and well being. Our sponsor, CBD Dog Health, offers the highest quality, full spectrum CBD products for pets that are 100% natural, third party tested, and made right here in the USA. CBD has been proven to be a natural anti inflammatory, pain reliever, and studies even show that it can help to reduce seizure frequencies, ease stress around triggers, which makes it powerful for treating PTSD, anxiety, panic disorders in animals and people alike. We've been using CBD dog health products with our French Bulldog, Milka, for years now, and I don't ever want to run out of them. Their tincture called Calm has made a world of a difference in reducing Milka's separation anxiety, and it is our go-to for us in new places, restaurants, or loud settings. And it works so fast. And the East tincture has been fantastic in supporting Milka's joint health and managing inflammation. So if you're ready to see the benefits of quality full spectrum CBD for your dog, cat, or horse, head over to podega.us and use the code CBD for 10% off your next order of CBD. Free shipping on qualifying orders in the USA. Again, visit podega.us and use the code CBD for 10% off your next CBD order. Terms and conditions apply. All right, let's get back into this episode. When I see people ask for a veterinarian, and some people, they shop for veterinarians based on price, right? Which I think sometimes it can be quite tricky, right? So
Yeah.
because a lot of the times, like we do see that integrative or holistic veterinarians tend to have a higher consultation price
Mhm.
compared to conventional veterinarians. But I would say that the value that you get when you go to integrative or holistic veterinarian, it just cannot be matched. Like from our experience, I mean, we s- we did a consultation with Dr. Kendra Pope for our dog, and I think Charlie, you said how long was the consultation? It was a minimum 2 hours. They are emailing us beforehand before we even get there. They're asking for medical records from every single clinic we've ever been to. They're checking it. They want to know everything that we feed to our dog and whatnot. I don't want to get into too many details, but the point that I'm trying to make is that the amount of work that an integrative or a holistic veterinarian does compared to, or the amount of time.
Before, during, and
And
after.
after,
Exactly.
thank you,
Yes,
thank
and
you.
after, it's just like the value is just like it just cannot be matched. So I mean, it's just mind blowing, like the amount
L
of time that
l
is spent personally to really understand and get to the root cause of the problem, right? Because
Yep.
I find that holistic and integrative veterinarians, they often try to figure out what is the root cause compared to conventional, where the tools that they use often just mask symptoms.
Right. And then you're still, and that's such, and thank you for explaining that so
Hmm.
beautifully. I mean, everything you said was absolutely accurate and spot on, is that
Hmm.
the price of a integrative or holistic consultation is always more, because the time that we spend, as we've already
Hmm.
discussed, a conventional doctor may spend 10 minutes in the room, maybe 15. They usually do not do a thorough record review before you walk in. They're like, "Oh," they don't know. I mean, a lot of times there's not a big, unless they're a specialist, then sometimes they
Hmm.
really are. But, a standard conventional visit, you're not going to get that thorough review. You're not going to get very much time, and you're not going to get that after, like you talked about, before, during, and after. And one of the things that I do is also provide people with a very customized written, typed wellness plan that I send to them that literally is a step by step. And here's your priorities and here's your that. And I'm sure you guys got that too with the great care that you got. But that is like not at all within the realm of what you're going to get from a conventional. And so there's that value is, yes, it's more expensive to see us, but the reason is because we not only doubled, I mean, we more than quadruple the amount of time that we spend on each patient, maybe even far above that than what a
Yeah.
conventional doctor does. But as you said, the reason we do that is because our whole goal is to help that pet get well and get and with conventional medicine, as Larry so wisely pointed out, is oftentimes it's symptomatic and it's masking things. And even though, and not always, even though the symptoms may temporarily get better, and sometimes they don't even do that, the real problem still is brewing and continuing and progressing. And so ultimately, even though you've spent less on your office visit when you see a conventional doctor, if your pet's not getting well, you're continuing to spend the same and the same. And, you know, and of course, skin is just a perfect example to use, but pets with allergies and skin problems, such a huge common problem in especially dogs today, dogs and cats. But these skin and allergy problems, I mean, people can spend tens of thousands of dollars even in conventional veterinary medicine, and the pet never gets better. And it's just round after round of antibiotics and, allergy injections and antifungals and, again and again, and skin scrapes and skin cytologies all the time. And it's still bacteria and yeast there. And, you're just running up all these bills. And the worst thing is you've spent all that money and the pet's still miserable. And that's what's so frustrating for people.
Yeah.
And so, it's just that sort of understanding that I would love that this podcast, thank you, will portray to people is that you may spend more money on the front end of meeting with an integrative holistic person, but I I mean can confidently say that will save you money on the back end, and more importantly, your pet's going to be better. Like, it's so much better to pay for better health than
Yes.
it is to pay for sickness. Like,
For
let's
sure.
get out of the sickness, and and it can cost a little more investment of time and money. And you talked about time. A lot of people aren't used to going to a veterinary office and being there for 2 hours. They're used to that, 15-30 minute visit. And so it's an investment of time and money, but boy, is it worth it. So
Yeah.
It's such a completely different experience, just like everything about going to an integrative or holistic veterinary clinic is just so different. It's like it's about the animal,
mhm.
like Milka just absolutely hates even being put onto a table, like she hates it. But like from our experience, all of the veterinarians or all of the integrative or holistic veterinarians always got down to the floor with her. Like they wanted to make her like feel secure.
To be honest, when it comes, we actually did the math on the price of like comparing going to a conventional veterinarian for the same amount of time that we had spent with the integrative vet. And honestly, it comes out to be around the same price. Like if you actually were to pay for, 5 to 8 consultations with a regular vet, which would
Right.
be the same time that we had with the
Time frame.
integrative vet,
Mhm.
it actually comes out to be around the same price. So it's just that with an integrative vet or a holistic vet, you would need to spend that money up front versus with a conventional veterinarian, you spend it each time you go there for 20 minutes or 15 minutes. So it's actually, it depends on how you look at it.
Right, but what a brilliant way to, look at that. And it's really great that you did that to, to prove that and to share that now. And when all that time is spent in one session versus spaced out over 8 sessions, you're going to get a better result because you're much more integrated in how you're going to take your next steps than spacing that out. And each time there's so much going on in between that you're kind of back to square one. And, it's really hard to have that true progress that's really going
Yeah.
to achieve better results. Yeah.
Yeah. And just another thing to share as well with our personal experience going to an integrative veterinarian, just for pet parents that are listening to really understand the difference between what it's like as a pet parent to go to a integrative veterinarian. In our case, we went to the integrative veterinarian and because of some blood work that was not really that normal that we had with Milka. So we wanted to like investigate what that's about. And like the integrative vet, when she came in, she literally like started like, okay, so where is Milka from? Where did you get her as a puppy? And like, do you have you know, blood work from when she was a puppy? And okay, when you got her, like when was her first vaccination? And then like what was she eating back then when she was a puppy? Like that's how far back she went, and no other vet has ever asked us that question. So
Mm-mm.
and it really goes back to like what you said earlier, n what was it, n of
N of
one.
one.
Like it's really about that one individual dog
Right.
and the lifestyle that that dog has lived its whole
Yep.
life. So
Yep.
yeah,
The more we
it's
can
just
learn about the individual, the more we can help them. Yeah.
mhm,
And conventional
exactly.
medicine, again, is just, it's so compartmentalized. That's part of conventional medicine is they just look at what's exactly in front of me right now without, a lot of that backstory and back history.
Mhm,
And conventional medicine often, like I said, just each compartment, if they identify a heart problem, that's all they're looking at, and other things aren't taken into consideration. And so that's the time requirement that that's why we need that amount of time from an integrative or holistic approach, and that's what makes it so effective. But I love how Larry said too that yes, we get down on the floor. I mean, every holistic practice that I've ever been in, and of course all of mine, we have the cushy padding on the floor, and we sit down with the pet, and really connect and connect with the pet parent too, because that's really, I think, an important part of the process in supporting both the pet to get better and the parent to care for them well, is to really make that connection. And I would say that I think that's a good strategy for people to be aware of in choosing a vet. It also made my heart smile when Charlie said she just wants everybody to have that feeling of what it feels like to have a vet that you can trust. And,
mhm,
it almost brings me to tears because that's what I love to provide for people. And I would advise people, when you are looking to choose a veterinarian, go by as many personal referrals as you can. If you can get any, check with friends, check with
Yeah.
family, check with neighbors. Does anybody else know a vet that's whether we're talking conventional or integrative, any medical care to provider, you want to get as a personal referral if possible, to get that background that somebody else thinks they're great. And then you can check reviews and just take that with a little bit of grain of salt. But somebody who's got a lot of great reviews, that is obviously a good a good sign. But most importantly, you go meet them and you make an
mhm,
appointment, and you go in and you see what you feel. Are they communicative? Are they care? Do they have a caring energy? Do they make your pet feel good? A lot of practitioners are gruff, and they're rushed, and they're just they're not. And if you don't feel good about being there, and you can see your pet doesn't either, then I would make a different choice and go explore other options. And don't feel like just because you had an appointment with somebody that you have to stay loyal to that doctor forever just
Yeah.
because you had one appointment. You can you have choices, and it's good
Mhm.
to exercise those choices. And so that's something. And don't be afraid to say no. Don't If a veterinarian is really forceful and you are feeling forced and pressured, that's also somebody that I would choose not to work with, if at all possible. But also don't be afraid to say no. If they're recommending vaccines and they're really adamant about it, and really making their case, fine, let them make their case, but say, thank you for the information, but I'm going to decline that today. et cetera, and then go, so and when that comes to anything. So I think people, they're like, well, they're the doctor, they know what they're doing. And even though they know in their heart and their gut that that's not what they want for their pet, they'll go along with it and then they'll regret it, and or the pet may, have a negative, um, ramification of it. So
Yeah.
that's part of empowering pet parents too, is stand in your power and know that you are your pet's guardian and your pet is relying on you
Yes.
to act in their best behalf. And if that means you have to say no to a veterinarian, then say no.
I absolutely love that you just said that because it's so, so important. I think, I always try to think about my own experiences. And, unfortunately, we have had some experiences where it was like, this doesn't feel good, or I feel a little bit of guilt from what this veterinarian might be saying. I don't really feel comfortable right now with doing whatever kind of treatment the veterinarian is recommending. And just an example, we had to do an ultrasound for Milka just to check out her liver, make sure everything is okay. And the veterinarian was quite had like quite what would you say, like quite an attitude about the way that he wanted to do the ultrasound on her. And we were like, it feels a little bit rough,
because we didn't want to give her a sedative.
Yeah, he was a little bit rough, and then he wanted to give a sedative, and we were like, we didn't really want to know, or we were like, hey, what's the name of this medication? And I think I would say to the viewers and listeners that go to the clinic, or go to your meetings with a pen and paper and write down everything that they say, because it is so important, because you really want to know what it is that your pet is taking, and just check, even if you do give it, check and see what did I give, research the side effects if there are any side effects, and try to then work with an integrative or holistic veterinarian to see how can you offset whatever you may potentially be harming your animal with.
But
Yeah,
what
I
you were
love that
saying,
suggestion to write things down or to ask for a little more explanation from that veterinarian. And if they're rushed or they're hesitant to give it, definitely do your own research. Try to get as much communication from them as they're willing to provide. But like you said, then you can go do a little research on your own. And better
Mhm,
yet, if you can, tap into that second opinion with an integrative consult, and then you can make your decision. So it's nice for pet parents to not necessarily feel pressured to make a decision in that
mhm,
visit. They can
mhm,
say, okay, thank you for the information. I really appreciate it. I'm, really want to do the, the best plan for my pet, but I may need to check, with some
mhm,
other, factors, or with my
mhm.
finances, or whatever you need to do to sort of, be able to not have to feel pressured or guilted into that next step without taking a beat and researching it and feeling good
mhm.
about it.
Yeah.
And I love that you said that earlier, because so many pet parents, like even us, we do like, it is hard sometimes to speak up for our pets, because at the end of the day, like, and again, this is why I just love being at an integrative veterinarian's office, because I can trust like at what point is conventional medicine really necessary and at what
Mhm,
point isn't, right? But like a lot of times, like for example in the case that Larry just mentioned, like we ended up actually leaving and not getting the ultrasound, because we said, look, we don't feel comfortable with this right now, we're gonna look at this medicine at home and then we're gonna reconsider.
mhm.
Good.
So but
Yeah.
like, and it, guess what, it was no problem at all. Yeah, probably that vet doesn't really like us that much, but like at the end of the day, it doesn't matter, right? Like what matters is to protect our pets, and it's really difficult sometimes to do that at the vet office. But also we get a lot of pet parents who tell us stories where they were like, look, I did this against my better judgment, and now my dog has XYZ, and
Mhm,
this is truly heartbreaking, because those pet parents, they do feel responsible or some type of guilt around it, and that's just heartbreaking, because at the end of the day, it's not your fault, right? Like
Right.
it's not your fault that this, like at the end of the day, like we do need to trust our vets. So but again, it's just a reason to really shop around for the veterinarians, and those were
Yep.
really good good those were really good, like, options that you gave earlier on how to find a vet that really works well together with you.
Mhm.
Good. I'm glad that'll be of value to people. Yeah, and just for people to know that they can pause and, like, for instance, for your situation with your doggy with the ultrasound, again, you going home and thinking about it and researching it and sort of, putting a plan of action that feels good, whether that's going to somebody else who might do the ultrasound without a sedative, or
Mm-hmm.
if it's just rescheduling, going back to that doctor and say, okay, we looked at everything and we'd like to make the appointment to proceed now with the
Mhm.
diagnostics. You can always take that pause and then re-coordinate your plan, and then you can feel better about it rather than feeling regret that you were, you know, pressured or prompted into something that didn't feel right. So,
Mhm.
Absolutely. Just one funny thing to share about the situation. We did end up going to a different vet who had a very great approach at doing the liver ultrasound, and she sat down with Milka on the floor, and she did it all on the floor. She did it on Milka's terms. We did have to help and hold Milka still, but then we got the we got the report in the end, and in the report it said, everything's fine. Everything's absolutely fine. Although Milka was not very compliant.
right. She was wiggling or
Yeah,
whatever. So,
yeah,
sedation might have made it a little more still, but they were able to get the
Mhm.
results,
Mhm.
exactly,
and
Mhm.
so, yeah. So, and
exactly.
everybody's individual. I mean, most dogs don't need for a standard ultrasound, most dogs don't need sedation. But,
Hmm.
if some dog is so nervous that, because that's impactful for them too. I mean, that's taking a toll on their health when they're like in extreme anxiety. So there are certain circumstances where that's the N of one, it may be appropriate for some individuals, but not necessary for a lot of them. And then there's
Mhm.
other fun holistic tools that you can give them CBD before the appointment, or
Exactly.
Yes.
other anti-anxiety things, and reishi and ashwagandha and all these things
Mhm.
to help calming. So it's always fun to bring in all those natural tools to support the best
Hmm.
process when you have to do testing, etc.
Yeah,
Mhm.
we love
Yeah.
CBD.
Yeah. Okay, so I think that when now a pet parent might be wanting to search for a holistic vet or an integrative veterinarian, but I would say that we have to be honest that it can be quite difficult to actually find a integrative or even a holistic veterinarian. My big question is, why are we seeing so little integrative and holistic veterinarians?
Yeah, I know that oftentimes we're in high demand, so
Mhm.
we can have potentially longer wait times than conventional veterinarians. However, even conventional veterinarians like specialists sometimes will have significant wait times. And the reason why it may be more difficult for people to either find or access or get into an integrative veterinarian is because there's less numbers of us. Everybody that goes through veterinary school is trained conventionally. And
Mhm.
so any holistic and integrative training and experience that we're going to get is, of course, outside of veterinary school. So the good news is that it is a growing sector in medicine. I
Mhm.
mean, more and more people, I mean, we know, I mean, I think, you guys certainly know, and most people may have an inkling that this is where health and medicine is going. I mean, we've
Mhm.
really, again, we need the conventional system for, the trauma and the crisis and all that time that we need, but true, you know, impact and interest from, many people now is is targeting for integrative, and what are natural ways of healing, what are more preventative ways, what are more successful ways to stay healthy rather than to wait till we're sick. We want to be
Mhm.
proactive to stay healthy, that rather than reactive to treat illness. And more people are definitely jumping onto this bandwagon,
Mhm.
which is
Mhm.
awesome. And so there's a growing interest and demand for holistic and integrative. So more younger veterinarians coming out of vet school in today's times are getting into these fields. So the
Mm-hmm.
numbers are growing. The other beautiful thing is there's a lot of free content becoming available through beautiful podcasts like this, but also with other veterinarians out there doing, the YouTubes and the videos and the, courses that are either free or even, minimal cost to learn. And that's all very, very helpful. It's not the same as customizing for your patient. So you still, or your pet, so you still want to be able to access an integrative veterinarian at certain times, obviously, to help with a particular wellness plan for that pet. But the options now are, if somebody's near you, if they have a long wait time, you could always get signed up so that you can get into a physical, a physical presence exam when they are available, and or tap into a telemedicine option,
Mm-hmm.
which usually the wait times are generally less, although sometimes those can be long too. The good news is my wait time is not long at all. So, if people want to tap into me as a resource, which I would be very, very happy to provide, the wait time is not long. But, it's just, and again, I love the phrase, it takes a village to raise a child. So, the more resources that you sort of accumulate for your pet so that you can tap into, and that can depend on who's near you, who's available, who, you really like, and who is giving the types of services that you're looking for. And when you have a small collection of that, then you can get, the greatest support network going for your pet. But yeah, wait times definitely can be an issue, but I think right now it's actually better than it was in the pandemic. I think the pandemic was
Mm.
it really stacked everybody up, even conventional appointments. And
Mm-hmm.
I had a wait time of 8 to 12 weeks a few years
Wow.
ago. And now I have a wait time of a couple of weeks.
Mm-hmm.
It's, 1 to 2 weeks even sometimes. So it's definitely getting better, which is really awesome.
And for anyone listening looking for a vet, in general, I think it's very important to find your vet before your dog gets sick, and before you have an emergency, no matter if you're looking for a conventional vet or a integrative or a holistic vet. It's always good to, like, go visit different veterinarians. And like, you could even just, like, I mean, especially with conventional veterinarians, you can even just go and like talk to them for 15 minutes. Obviously you're going to
Right.
pay for a
Donate.
consultation, but you just go and talk to them, and just make sure you guys are both on like the same
Mm.
uh
Yep.
Terms.
Yeah.
terms, and things like that, and just like shop around for veterinarians and see who you you
Feel
relate to, and you feel like this could be
aligned
something,
with. Yep.
because once you have an emergency, you're going to want to have someone already that you
Yep.
trust.
Yep. I
And
love that. Establish care or establish a team, and, know who's in the area for urgent care versus, routine care. And again, you can check them out with reviews or just walk in and meet them. There are some fabulous urgent care veterinary facilities in our area, and even one that is called VEG, and it's, they have other locations around this area, Veterinary Emergency Group, and they practice in a very unique style. All of my clients love going there if they have to do something that's urgent, and they literally have a system where they never separate the owner from the pet, which
Mm-hmm.
Mhm.
is, I mean, unless maybe they're going into surgery, but as far as you waiting there with your pet getting examined, evaluated, the blood getting drawn, everything, you're right with your pet. And it is, people just rave about how making a stressful situation the most pleasant experience for the pet and the person.
Mm-hmm.
And so just giving people sort of, a scope of what can be out there, depending on your area, you can at least explore what options you have, so that
Mhm.
when, like you said, when you're in a situation where need access to somebody right away, at least you have a plan of action or a support group ready to go.
So, Dr. Katie, for anyone listening who would like to work with you or consult with you, can you just tell them where they can find you, please?
Absolutely. So my practice name is Integrative Veterinary Care. And my website is Int Vet Care. So it's INTVET care.com, intvetcare.com. We didn't want to make anybody spell integrative or even veterinary for that matter. Those are two of the most misspelled words ever. So Int Vet Care, super easy. And our social media handles are also Int Vet Care on Facebook and Instagram. So you can follow us there. You can go to our website and check out the services that I have, or click request an appointment or a consultation. I'm in the San Diego area. I do have an in-person clinic, but I am there limited time. So I would say, currently about 25% of my practice time is actually in person and 75% is telemedicine. So I have availability with both, but that's a good way to find me and reach me.
Excellent, and we'll definitely be sure to include all of these details in the show notes and the description section of whatever platform you are listening or watching.
Thank you.
Thank you so much, Dr. Katie, for taking the time today. This was truly such an amazing conversation. It's a topic that is so dear to my heart because, like I said, I know what it feels like to be in good hands, and I just want everyone else to also feel that feeling. And veterinary care is just such a important topic to find the right person. And I think our listeners today have really got a really clear understanding of what the difference is between conventional and integrative and holistic veterinary care are, and can make a decision of what's best for them and for their pets. And I'm just very grateful for this.
Much. Same. I'm so grateful that both of you brought this discussion forward, and this very particular topic to support people with decision making is so beneficial. So thank you for organizing this and for having me join you to support this message.
Thank you so much.
Thank you.